Layoffs taking place in Oklahoma's healthcare industry.
In the past week, two of Oklahoma City's largest providers, Integris and OU Health, have said they're cutting jobs, and a bunch of them. News 4's Nick Camper is looking into the reasons why. Nick?
Yeah, I wanted to know if this is a sign of things to come, and because of rising costs due to inflation and the continued care of COVID patients, more hospitals could trim their staffs.
Hospitals are just as impacted by inflation as other businesses.
Patty Davis is the president of the Oklahoma Hospital Association. She warns healthcare providers could face the same struggles seen across the country as costs continue to rise.
We've seen other large systems have reductions in force. Oklahoma is not an island. We are not any different than the rest of the states.
Another issue, the high cost of caring for COVID patients.
The pharmaceutical drugs that were developed for COVID, in combination with a lot of resource-intensive therapies, taking care of COVID patients in the hospital is very, very expensive.
In the last week, OU Health and Integris have dropped 300 positions combined. Officials with OU Health tell News 4 the company is reorganizing and eliminating duplicate positions, which amounts to 100 jobs. Integris Health released a statement this week explaining why 140 workers were let go and 60 vacant positions were eliminated. A spokeswoman saying, "Financial challenges are multifold, but some include a dramatic rise in expenses due to labor shortages and supply chain disruptions and significantly lower patient volumes compared to pre-pandemic days. We've reached out to SSM Health but have not heard back." A spokeswoman for Mercy Hospital says they are not planning layoffs and continue to work around rising costs and the labor shortage. Davis says rising expenses hurt hospitals more than other businesses because they sign fixed-rate contracts with insurance companies to cover medical costs.
Let's say a hospital signs a contract in 2019, and that's before COVID hit. Well, the world is very different in terms of expenses in hospitals.
Integris did not give an exact breakdown of what positions were let go, but says the vast majority of the cuts were from corporate and administrative positions, and a spokeswoman says the cuts will not impact patient care.